Hey everyone! Welcome back! Today I'm diving into something every dental student needs to master Engel's classification of occlusion. Ready to get those study notes out? Alright, so Engel's classification is all about understanding the relationship between the upper and lower teeth. It's key for diagnosing and planning treatments. There are 3 main classes you need to know. Class 1. This is the normal bite. The mesiobuccal cusp of the upper first molar aligns with the buccal groove of the lower first molar. Simple, right? Occlusion looks good, but there could still be minor issues like crowding or spacing. Class 2. Here, the lower molar is positioned more towards the back of the mouth compared to Class 1. There are 2 divisions. Division 1, where the upper front teeth are protruded, and Division 2, where they are retruded or more upright. Think of those classic buck teeth for Division 1. Class 3. This is the underbite. The lower first molar is ahead of the upper first molar. This can give that bulldog appearance. Treatment usually involves orthodontics or, in severe cases, surgery. Remember, understanding these classes helps you identify malocclusions and plan the best treatment for your patients. So keep practicing and soon you'll be diagnosing occlusions like a pro. Alright, that's a wrap for today. If you found this helpful, hit like and subscribe for more dental insights. Keep those smiles bright.